All right. Well, thank you, Michael. Thank you, Michael, for inviting me. I wish I could be on here a little more often. I'm going to keep working on it. We have Gina, who's representing Active Health on the days that I can't be here. But I thank everybody for your attention today. I'm excited. We did take a 1-hour presentation and scrunched it down into 15 to 20 minutes. So I'm going to do my best to keep within the time frame that Mike's allotted me. So let's get started. We always address body strength, right? What do we say when we're going to the gym? Today we're going to do upper body, and we're going to work on our core and pelvis, and today's lower body day. Well, as a chiropractor, which is what I am, I'm going to talk about that in a second, I always knew the importance of neck strengthening and how important it was, but it became very difficult to do in practice. I am going to share with you today research and some information about why neck strength is the missing link in not only neck conditions, but also overall health. So I'm going to hopefully tie that together. Again, I am Dr. Marc Weinberg. I'm not going to spend a lot on who I am, but I have been practicing. I'm going to transition over here to career highlights. I have been practicing over 35 years, almost 30 years in the same location on the east end of North Lake Boulevard at Active Health. Through my years of being in practice, we realized that the physical things that we do on a daily basis tend to affect our body and our physical posture. I'm going to talk to you just quickly about this organization right here. Does my mouse show up? Can you see my mouse or no? Yeah? Okay. So I got invited to be the board of director for the American Thoracic Outlet Syndrome Association. Some of you may know what that is, but thoracic outlet syndrome is we all know what carpal tunnel is, right? Well, thoracic outlet is like carpal tunnel syndrome of the shoulder. And we started working with patients that had this horrifying condition because it's actually pretty bad. And that's how I got on this board. Now, why am I sharing that? Well, from the successes that we had with what's known as TOS patients, I got invited to write 2 chapters in a textbook that's being currently used for the condition of thoracic outlet in medical schools. So I say this for 2 reasons, not to toot a horn, but number one, I'm probably the only chiropractor that's been invited to write anything in a medical textbook. So we're proud of that. But on top of that, I'm going to talk to you in a couple of minutes about what happened when I got invited to do that, to write those 2 chapters and the research that had to come from that. So we'll talk about that in a minute. In 2009, we became the first office in the state of Florida to introduce a technology called the MCU, the multi-cervical unit, which is what Michael did in our office. And I'm sharing that because only because he had mentioned that. We opened up our physical therapy department. We expanded in 2010. We got a second MCU in 2013. And then we expanded our practice for a second time. And then we actually added a regenerative medicine department. And some of you may say, why would a chiropractor want medicine in their practice? Well, it still aligned with who we were by doing regenerative medicine. And hopefully one day I'll get an opportunity to share that with you. But today, we're going to talk about neck strength. This is my current team. We have 4 chiropractors, myself included. We have Dr. Adam, who's our physical therapist, and then we have a nurse practitioner as well. So with that said, you got to learn a little bit about who I am and what we are. I know Haley was mentioning about doing branding, and we had found somebody that helped us do some branding, and she actually went out. And you know how companies will say, we're the best in town, and we do this and we do that, and that they're just statements that people made and think they do those things. Well, what this lady did, very similar, I would assume, to Haley's business, is she went out and asked all of our patients, our lawyers that we work with, our medical doctors that we work with, friends and family, who they thought Active Health was. And they came up with these 4 pillars. The first was that patients and goals are our first priority. They came up with the fact that we are a team of diverse providers. What that meant was all of our doctors, we meet every single week and talk about our patients and come up with what's best for our patient. One of the things they found out that people were making notice of was that everything we did was geared towards getting patients better. It wasn't just another thing that we were adding to the practice. And last but not least, we treat you like family. So that's enough about who we are. I wanted you to have a little bit of understanding about where we come from at Active Health Center. And there's actually some very familiar faces in the audience today that have been of Active Health. And it's nice to see you. I haven't seen you in a long time. So what's so important about the neck? Well, the brain is the computer of the entire body. So if it doesn't get much blood, it's going to perform under par, and all the systems of the body are going to malfunction. Dr. Carolyn, I know in a prior presentation, this is what she does. I'm going to leave this concept of how the nervous system controls everything in the body up to Dr. Carolyn, and I'm going to move my attention more to how to stabilize the things that I do as a chiropractor, Dr. Carolyn does as a chiropractor as well. The vital part of the brain that controls our heart rate, our breathing, immune system, hormones, all of those things comes down at the lower part of the brain, which enters right in the neck area. Everything that's automatic in your body that keeps your body healthy is controlled by that. And then last but not least, stress, posture, misalignment is going to reduce the blood flow and the nerve supply, more importantly, to and from the brain. So the reason why I show this slide is because the neck and the spine, of course, in general, but today we're focusing on the neck. The neck is so important for overall health, and I'm going to hopefully show you that today. So I put this slide up because this is chiropractors have been saying this for over 100 years. Now the MDs are starting to see, maybe the chiropractors have something. And this doctor, he fosters the neck connection, and he says that the problems around the neck cause psychological, emotional, physical problems, and by improving the blood and nerve flow, everything comes back to normal. We are seeing more and more medical doctors understand chiropractic. We have numerous patients of ours that are medical doctors, so it's nice to see that our whole health community is starting to understand the power of our body when it's functioning properly. Real quick, just a couple of stats: 2 out of every 3 people experience neck pain at some point in their life. And then also, this is something we're going to focus on. Sophia, I know you know about this. Whiplash injuries, very, very, very common. And we're going to talk about that a little bit in a little more specific. Okay, what are some of the common causes of neck conditions? Well, we know motor vehicle accidents. I can't see everybody because of the presentation screen, but I normally say, hey, how many people here have been in a motor vehicle accident of some sort, even if it's a minor fender bender? And usually 70 to 80% of the room will raise their hand and say, yes, I have. Lifestyle and posture are some of the common causes. We're going to talk about that in a second. Workplace injuries, sports injuries. These are the more common reasons why we develop neck conditions. And normally I like to get my audience involved and ask questions, but everybody's muted, so I don't think it's going to work. So let's talk a little bit about motor vehicle accidents. 62% of all patients or people that are in a motor vehicle accident have whiplash or a whiplash type injury. 28% of those people will have chronic, long-standing neck pain. And there's a reason for that. And we're going to talk about that because there is ways of preventing you from having these chronic pains. And if you have chronic pain secondary to a neck condition, we can help you with that. So let's take a look at this. This is actually how fast an accident happens. The average rear end collision occurs in about 250 milliseconds or a quarter second. It is literally the blink of an eye. That's how fast it happens. So the injury, we're going to slow it down now. You can see what happens here where the person actually, the seat goes back and it becomes a ramp. And people will actually ramp up, which increases the angle of how their neck is being whipped back and forth. So we're going to go to the next slide. This is amazing. What we're going to look at, this is a live camera showing what happens in a motor vehicle accident and the trauma that happens. So I want everybody to look at the top right, and you see the frames going by. We all know what that is, right? That's the frames of the video that's playing. So let's go a little bit to the left of that, and you see the 99/01/10. I'm going to throw it out there. I know you guys are all muted, but what is that? Obviously, that's the date. So we have January 10th, 1999. What are those 6 numbers to the right of it? The 11:31:51. Some of you are saying, oh,
The time.
the time. Thank you, Rosemary. Appreciate that. So what do you notice? I'm going to let you talk. What do you notice strange about the time?
It hasn't moved because it's all happening so fast.
Right, exactly. It hasn't moved. That 51 is seconds, and it has not gone from 51 to 52. All of what you're seeing there has happened within 1 second. Our body does not have the ability to protect. The muscles don't have the ability to contract and prevent that from happening. So I'm going to throw it out. Rosemary, since you're talking and I have you on screen now, how fast do you think this accident was?
I'm going to guess like a half a second or less.
No. How fast do you think the vehicle was going?
Oh, I'm going to guess like 18 miles an hour.
Most common we hear somewhere between 20 and 30. Occasionally we hear 40. This accident was a 6-mile-per-hour test crash. So you could imagine what would happen at even an 18-mile or a 30-mile or a 50-mile-per-hour accident. So a lot of trauma can happen even with mild fender benders. So car accidents cause issues. What about the things we do on a daily basis? This is a cartoon between the classes of the College of Laboratory Assistants. So we all snicker, and the reason why we laugh is because when something smacks of the truth, we find it funny. And we are seeing, and Dr. Carolyn can attest to it as well, and massage therapists that are on the call, you can see that people are starting to develop this forward head posture, starting to develop kyphosis, all due to sitting at the computer, being on phones, keeping our head down, and actually the ICD, the International Classification of Diseases, are now actually have a code for computer neck. And so we are actually living this. So what about what we do for a living? Does that affect us? Does that affect our neck condition? Well, here we got the stork going to the chiropractor. Darn those fertility drugs. I can't take many more of these multiple births. So picture the stork carrying a double birth. And then what about what we do at home? Is that affecting our neck? Absolutely. Well, here's your problem, Mr. Schul. And you can see that everybody has taco neck, including the dog. And you can see that from watching the TV on its side, everybody's developing taco neck. This smacks of the truth because I have patients of mine that keep their computer screen off to the left or right of their computer. And so they're always typing like this with their neck turned, and they want to know why their traps are tight and why their neck hurts. So this presentation normally I show about 10 or 15 different research studies that came out. We're only going to do 3. And normally we have 9 points that we go over. Today we're going to go over 3 points. And the first one, we're not going to read through this. I used to do that, and then I would get that deer in the headlights look as I was reading through it. So what we're going to do is we're going to whoosh the words away and put up what the synopsis was. And the synopsis of this research study said that the body's reaction to inflammation and pain is not tension and stiffness, but muscle inhibition, which is weakness. So you would think that, hey, when I'm inflamed and I'm in pain, I'm going to get more tightness, right? I'm going to get more stiff. Well, guess what? The real problem is the fact that the muscles are actually getting inhibited neurologically, and they're just not working. So we're going to put our facts here. And again, I'm only going to list 3 of these facts today. And that is that the neck pain and injury causes muscle inhibition. And these are all taken from research. Okay, let's go to the second one. And the second one says we're going to whoosh the study away. And this study synopsis said that in patients with neck pain, weakness is the cause. So that's kind of strange because Dr. Weinberg, you just said neck pain causes weakness. Well, guess what? Weakness now will cause pain. And what happens is we end up in this loop of pain causes weakness, weakness causes pain, and then we end up in this cycle where we continue to get worse and worse over time. So let's go to this study. And this one said that neck strengthening in the treatment of chronic neck pain must be included. So how did I find this study? Well, I talked to you earlier about the TOS chapters that I was invited to author, and I had to document and give references to every single word that I said when I wrote those articles. And so in writing those articles, I started uncovering research, one after another, showing that you must have strong muscles in the neck, and neck treatment must include strengthening. So this study was done, this particular one was done in 1991, and this information furthers the concept of the missing link in treatment. And I'm going to get back into the missing link in a second. So here's one I just found today. I figured, let me see if I can find another one I can throw in here. And this one literally says that there's a connection between neck pain and quality of life. So you can see here where it says what that study is showing is that it's raising the awareness of the possible future impact of neck pain on our activities and basically on our quality of life. All right, so what are some of the current treatments in neck pain? I need help here. Start throwing, unmute yourself. Start throwing some things out. What are some treatments?
Hydrotherapy.
Hydrotherapy. What else? Somebody else.
Trigger point therapy.
Trigger point. Go ahead.
Ice.
Ice. Good. More.
Acupuncture.
Myofascial treatment.
Myofascial, acupuncture. Good. And we can go on and on. Let's list them real quick. Chiropractic adjustments, which I feel is the most important, of course, to get alignment so that your nervous system is functioning properly. How about modalities? A number of those were mentioned. Ice and heat. What about laser? That's a newer modality, but still a modality. Devices, traction, things of that nature. Pills, potions, lotions. Okay, and that could even be supplements. It doesn't have to be medicine, but that could be supplements as well. Injections and surgery, which we want to hopefully try and avoid. Physical therapy, manual therapy, and then even mindfulness. Doing certain techniques, whether it's meditation or the self-discovery center, learning the techniques and doing present moment awareness. But all of these things, did I spell mindfulness right? Is that correct? Yeah, I think so. But all of these things are the current treatments of neck pain. We can do all of these. We can get laser, we can get adjustments, we can get PT, we can get lotions. Guess what? If we do all of these and our neck muscles are not strong enough to keep everything in alignment, we're going to continue to have problems. That's the missing link that has been uncovered. It's been talked about for decades, but they did not have the technology to complete it. So that is the missing link in neck treatment, is keeping your neck strong. And like we said before, we all know about working our abs and working our core and today's lower body, and we're going to do upper body, and we want to keep our mind strong and we want to keep our bones strong. So we take, proper supplements so we don't get osteoporosis. No one talks about keeping your neck strong. So it's very, very important. So the neck strengthening, years ago when I always knew the importance of it. And this is one technology we used to use. Guess what? I used it until the patient didn't attach it to the door properly, and it snapped and hit her in the back of the head and actually injured her. Also, the patients don't know, should we do the left side? Should we do the right side? Should we go backward, forward? Maybe the front is strong already, and you don't need so you don't know that when you're doing this. Here's another one where you can use a PT ball. Similar challenges. You don't really know which side to exercise. Here's this bozo slamming his head against the sandbag to try and strengthen his neck. Years ago, we used to use this, back in the wrestling days. This little picture, if anybody has been to a chiropractor, an orthopedist, or anywhere for neck pain, you've seen this picture, because this is the way we can do isometric exercise. But again, we don't know the proper direction, how much force to use. And guess what? Patients don't do it anyway, even though you give them those sheets. Here's another way to do it. This is something called the Nexus. We used to have this in our practice, similar challenges for neck strengthening. So being that all these things are here, everybody knew that neck strengthening was important, but no one does it because they didn't have the technology. So it's kind of like we just kind of forget about it. So here's one last study that was done, and this study was done by the journal Work, which was a workers' comp journal, and they found that the MCU, which is the technology I'm going to talk to you about, is the most effective way to strengthen your neck. This is the MCU. As I shared with you earlier, we have 2 of them in our office. It is literally a game changer. It is researched, so everything that we do and the protocol we use has research backing it up and why it works. It's safe. It's a one-time treatment plan. What does that mean? Well, Michael, I'm only telling your story because you shared it. Otherwise, for HIPAA, I would not have mentioned it. But you shared it. Hopefully, Michael, I'm going to knock on some particle board here, some processed wood, that Michael never has another neck injury and never has a trauma to the neck, because now that he's done with the MCU, he should never need it. Hopefully he's doing his exercises and some little bit of isometrics, kind of like the ones I showed you a few minutes ago. But now he knows his entire neck is normal strength. So he knows that he can go in any direction and keep that strong. Hopefully he'll never have to do this treatment ever again. It's the test. So what happens is we test the neck in 16 different directions, and we know exactly how strong or weak somebody is in all those different directions. And then if everybody can see back here, this is a weight stack. And so now we can customize the treatment plan and know exactly what a safe weight for Michael to lift and what directions he should be lifting. So it's the test and the rehab. And most importantly, it is evidence-based. And what that means, I will never look you in the eye and say, Mike, I think you're getting better. What I did with Michael is we did the test, and after he did his retest, we're like, Mike, you are 80% stronger. You are 119% stronger. You are now in normal range, all because we did evidence-based testing. It is covered by insurance. I know everybody asked. I'm going to quickly tell my story. My story, I was sitting at a Miami Dolphin football game, probably going on about 13, 14 years now, and somebody threw a 20-ounce bottle of water from upstairs, and I sat downstairs, and it hit me in the back of the head. I literally thought somebody took a baseball bat, because I didn't know it was coming. I thought somebody took a baseball bat and hit me in the back of the head. I will fast forward 8 months later. My practice was for sale and my home was for sale because I could not stop the pain, the headaches. I was going to every doctor in town. No one could figure out what was going on. Again, I'll make a really long story short. I had what was called a digital motion x-ray and found out that when I got hit with that bottle of water, I had 2 or 3 ligaments in my neck that were torn up by the top vertebra. And because of that, I was getting pressure on my brainstem, and it was causing all kinds of crazy symptoms. And now I realize that all the PT I was doing, chiropractic, mobilization, all of the stretching was not what I needed. What I needed was strengthening. So I went on my own, and I went and took my care into my own hands and found the MCU, and I found a convention, a physical therapy convention in Orlando. I went up there, they tested me, and I realized there was no strength in my neck at all. And so we eventually got the technology, and I am here to tell my story and tell the story of literally hundreds and hundreds of patients that have had problems like herniated discs, had torn ligaments, and we were able to get their body to heal by giving themselves their own proper support so that their tissues can heal. Injured tissues can heal if given the opportunity. But if you don't have muscle strength, guess what? You wake up, gravity kicks in, gravity works, doesn't it? And what happens is those discs get gnawed on all day long. By the end of the day, you're in worse pain than you were when you woke up. And then the next day, it happens all over again. By going in the MCU and strengthening your neck, your discs can heal. We have pre and post MRIs that show it. So don't think that, ligaments and tissues cannot heal. So I'm not going to talk about too much on evidence-based medicine.
We're pretty much done, Mike, if you don't mind wrapping it up. Thank you.
So I'm going to pass here. So here's the question. If there was a way to accurately diagnose if you had, or if someone you knew had neck weakness, fix the neck without side effects, do it in a safe fashion, be able to monitor results, and it was affordable, would you want to know, or the person that you know that has neck problems is a candidate for the MCU? I know there are a number of people that are around the country here on this call. There are MCUs around the country. I work very closely with the company because we have helped so many people, so I can help gear people towards an MCU that's in another state. But if there's someone that you know that's ongoing having problems, please have them. We are very passionate about it. We help people where others don't. You still need chiropractic adjustments. So if you're going to Dr. Carolyn or going to another chiropractor, we are never in the business of taking you away from another chiropractor. We just want to make sure that everything that those doctors are doing are staying in place. So I am Dr. Marc Weinberg with Active Health, and I'd like to open up if anybody has any questions.
Mark, I do.
Is that Shanda?
Shanda.
Shanda, hi Shanda.
Hi. So I had a sleeping injury 3 years ago. And I'm basically, I just recently went through some muscle testing to see which muscles were turned off.
Uh-huh.
And that was an experience. So I got to actually experience, with a chiropractor. And it was unique because I'd never been to a chiropractor before where they've done a series of muscle testing. And so you were talking about strengthening the neck.
Yeah.
So he has me currently doing get-ups and kettlebell swings. And so right now, because of just the muscle work that I'm getting done, is there a supplement, for muscle spasms, because muscles have been in a locked position or a stuck position for so long?
What I would recommend, I put up my cell phone, give me a call.
Okay.
Let's talk. I can definitely help. One of the things I didn't talk about, and again, for the limit of time, is when you go to a physical therapist for a shoulder problem, they work shoulder muscles. When you go for a knee problem, they work knee muscles. When you go for a back problem, they work back muscles. When you work the neck, PTs don't work neck muscles. They do shoulders and they do kettlebells, and that's not strengthening the neck. So give me a call personally. I'm happy to chat with you. I am available. My son's actually, believe it or not, having surgery on Tuesday up in Atlanta. So I'm available all next week because we'll be kind of rehabbing him. But please call me. Yeah, I'd be happy to share some information with you.
Okay, thank you.
Dr. Mark, I have a question.
Yes.
This was excellent. Thank you so much. My mom has severe osteoarthritis. Everything hurts. Hair hurts. Everything, including the cervical, right? The neck. So,
yeah.
For a person that has severe arthritis, she has
yes.
The back, when it's I don't remember what does any of this work? Because
many people that have severe arthritis, they're in a poor posture. Their muscles are not strong enough to take the pressure off of those swollen joints. So yes, she has arthritis. We have to quiet that arthritis down. That arthritis has to be less inflamed, and that can be done with nutrition and things like that, working with Michael and doing things like that. However, if I'm making this up, if her right leg hurts because she's leaning on the right, her right leg is always going to hurt. So we have to take that pressure off. And that's done by strengthening and building up the natural muscles that we already have. Again, that's my cell phone number. That's my email. Feel free to reach out to me. I am happy to help. Currently, I personally don't see patients. So I have a lot of time available to do consulting for people like yourself. That's what I enjoy doing. So please give me a holler. I'm happy to chat.
Thank you.